you're going to let people in and monitor the chat, correct?
Yes, ma'am.
All right, guys, welcome. Let's do this. Today's Thursday, right? I'm having to look at what day it is. All right, so we're on module 4. All right, let's go over here to my PowerPoint. I built this one. I think this is module 5. Yeah. Okay. As you all can see, this one is extremely long. Good luck
Taryn.
to everybody.
So are the dogs dead? Are the dogs?
I have the treat. We are going to bribe them today.
Well, I'm glad to hear that they have a second chance.
Like those, you can ask Charlie. Those are my babies. That's why she said yesterday they're just spoiled. They are.
Yeah. Oh yeah. I know. I'm a dog owner. I actually had a professional pet and house care service for 22 years.
What?
With my sister in South Florida. Yes, we did very, very well. We started pet sitting before anyone even knew what pet sitting was.
I am in constant need of a pet sitter because I refuse to put them at the vet in a cage.
Absolutely. I never did. And that's how I came up with the idea of doing that, you know, of starting that business. And I started it, quite honestly, I started it with a business card. I went and had 1,000 business cards made. I started with a business card and I built it up to be over $100,000 business a year. And I sold it for over $100,000 in October of 2006.
Wow. All right, guys, let's jump in. That's incredible. That means you're just a natural born marketer.
Yeah, I do like marketing. Okay, so don't forget to send me these. I'm missing Tuesday still.
You're missing Tuesday? Okay.
Mm-hmm.
I will get it. I will get it for you.
Thank you.
You're welcome. All right, guys, get your drinks, get your snacks, get your pens and papers and your phones to take pictures. Here we go. This is the only difficult module that I found through all 5. And this is also the most lengthy one. Module 5 repeats a lot of what we've already gone over. And then the test is literally the module exam put into a test form with a couple extra questions. So let's go. Okay. This is the brand new, take a picture, mark it down. Of course, I'm sending you this, but this is what is new, effective September 30th of this year in marketing. Okay, scope of appointment must be obtained 48 hours before all marketing appointments. The 2 exceptions are unexpected in-person meetings initiated by the beneficiary, and if the meeting occurs within the last 4 days of the election period. So it's not, it says relevant election period. That is not just AEP. That could be OEP or what the election period is. Requests to be and that is on the test. Requests to be contacted are good for 12 months. Examples are scope of appointment and BRCs. Those are good for now for 12 months. Marketing events can no longer be held following an educational event. You must wait 12 hours. A little extra tidbit for y'all. Scope of appointments may no longer be collected nor scheduling future appointments during an educational event, which is weird to me. Call recordings are only required for sales, marketing, and enrollment calls. TPMO disclaimer is updated to include references to state health insurance program, also known as SHIPs, and to require disclosure about the number of plans the TPMO represents. Don't worry, guys, I have it in here in just a few minutes. CMS has specified a list of topics that must be addressed with the beneficiary before enrollment. And we'll dive into these. I just wanted to make it at the beginning for everybody to see the big changes. Communications and marketing rules. Medicare marketing and communication rules apply to MA, MAPD, PDPs, Section 1876 cost plans, and MMPs. For MMPs, marketing requirements can vary by state. Plan marketing reps are subject to the same requirements related to marketing and communications as the plans. That is on the test. That is also on the final exam, not just the module exam. Plan marketing reps are subject to the same requirements related to marketing and communications as the plans. Plans are responsible for ensuring compliance with Medicare rules. Plan marketing reps are employees employed by the plan, individuals and entities contracted with the plan through a direct or downstream contract. Brokers and agents, TMOs, FMOs, GAs, and other marketing contractors. So everybody who is part of the plan is also part of the plan. Requirements to act as a plan marketing rep. Plan sponsors must contract or employ marketing reps that are licensed by the state they conduct activities in. Marketing reps must be appointed by the plan if required by state law. Charlie, will you remind me at the end to go back to that beginning slide for those who are just now coming in with the new rules? Thank you.
Yes, ma'am.
Thank you. MA and PDPs are required by law to ensure that all employed and contracted marketing reps complete training at least annually, including content specified by CMS. Reps must pass a written test each year with both Medicare and the products they are selling.
Wow.
Agents, brokers, marketing, employer union group plans are not required to be tested. Plans may choose to require testing. That is on the test, on both tests, not just the module exam, but also the final exam. That a rep must pass a written test each year with both Medicare and the products they are selling, unless they are marketing employer union group plans, and then it is up to the plan. That is on both tests. Third-party marketing organizations, TPMOs, are organizations and individuals, including independent agents and brokers, who are paid to perform lead generation, marketing, sales, and unrelated functions as part of the enrollment chain. TPMOs may directly contract with the plan sponsor, a downstream contractor of a plan sponsor, or may be a related entity of the plan sponsor. First-tier downstream or related entities, or FDRs. They may also be entities that are not FDRs but provide services to an MA plan or an MA's FDR. You want a cookie? Marketing and communication. Communications are materials and activities that provide information to current and prospective enrollees on Medicare health plans and PDPs. Marketing is a subset of communications distinguished from communications only material and activity based on intent and content. Marketing activities and materials are subject to a higher degree of regulation and oversight. The only thing you need to know about this is that if you're going to, and it may go into this in a minute, but really where they talk about marketing and communication is that before you post something to social media, it must be CMS approved through the plan. Marketing intent. The purpose of marketing activities and materials is to draw current enrollees and prospects' attention to a plan or group of plans to influence beneficiaries to stay with or choose a new plan. Marketing content activities and materials include or address content regarding information about benefits or benefit structure, premiums, cost sharing, rankings, measurement standards such as star ratings, plan rewards, and incentive programs. I was very shocked on the test that I took that there was not a lot of questions about star ratings. Communication only materials and activities. Provides information to current and prospective enrollees that contain no marketing content or include marketing content without marketing intent. For example, CMS designates certain materials that have marketing content, such as an evidence of coverage, known as an EOC, as communication-only material, while SOB and ANOC are marketing materials. And you'll notice a change. Summary of benefits is what those mean. A targeted letter to remind plan members to get preventative service they have yet to receive and list cost sharing for those services. While it contains marketing content, it does not meet the marketing intent and standards. So basically what they're saying is, if it's a communication from the plan, it is not marketing, even though it lists plan benefits. Where they're talking about marketing is when you're trying to entice to sell, using benefits for that reason. Regulation of communications, activities, and materials, content. CMS does not generally require communications only materials to be submitted to CMS for review and approval. It does require certain disclaimers to be used on these materials. CMS also prohibits the use of certain claims or language. CMS does require certain communications, EOC, critical to beneficiaries' understanding and assessing benefits to be reviewed. They actually require that whenever plans are making the EOC, that it needs to be not above a 6th grade level. Even though when I read it, it's greatly above 6th grade level. CMS may require prior review of communication material that based on feedback, such as complaints or data gathered through the reviews, warrant additional oversight to ensure accuracy. Everybody hanging in there okay? All right, just making sure. Regulation of communications only. Contacts. CMS regulates how reps can contact potential enrollees. CMS may require disclaimers or other information included in materials. We will get into that in the future slides. CMS also prohibits certain claims and language. Content. CMS regulates what reps can say to potential enrollees. Setting. CMS has rules regarding marketing in a healthcare setting versus marketing in other settings, and marketing educational versus marketing events. Can anyone tell me what the rule is about healthcare settings? What area? Common areas. Who may market? CMS requires reps to comply with state laws for licensing. CMS places strict limits on marketing by healthcare providers. Timing. CMS regulates when reps can market the next year's plans. Review and approval. CMS requires all marketing materials to be submitted to CMS for approval and or review. Materials used for employer and union groups do not have to be submitted. Rules that apply to all communications. Plans and their representatives may not mislead, confuse, or provide false information to beneficiaries. Target enrollees based on income levels, except for DSNPs. That is on the test. Target enrollees based on income levels, except for DSNPs. Target enrollees based on health status, except for CSNPs. The way they word that question is, if somebody wants to provide their health records, what should you say? There's an answer that I feel like most people are going to say is that you cannot ask health-related questions under any circumstance, but the correct answer is you may ask if it qualifies them for a chronic special needs plan. State or imply that plans are only available to seniors rather than all eligible Medicare beneficiaries, younger and disabled. So you need to say Medicare beneficiaries versus seniors. That is no longer allowed. Marketing representatives are not to make unsolicited contact with beneficiaries, including through door-to-door, includes leaving flyers, leaflets, or door hangers at a residence or a car. We actually, I worked for somebody somewhere long ago maybe not that long ago, I'm not going to give that information, that wanted us to go to apartments and put flyers on doors suggesting that if they have Medicare, they can attend a meeting. That didn't go over well. Approaching beneficiaries in common areas such as parking lots, hallways, lobbies, sidewalks, stores, or parks. Telephone calls, texting, and other forms of electronic direct messaging, including social media platform and instant messaging. Guys, if you're going to put something on your social media, make it a post to everybody on your social media and make sure it's approved through the carrier if you're going to have anything that pertains to benefits or carrier specific. That's my advice. Voicemails, what you can do is you can email, you can snail mail, and if you don't know what snail mail is, it's the USPS, put a stamp on it and mail it, and other print media like advertisements and newspaper printings. Those are allowed. Unsolicited contacts. Market reps may not make unsolicited calls about other business as means to generate Medicare plan leads. It's called the bait and switch. Make unsolicited contact based on referrals by enrollees or other source. You can leave your business card with the beneficiary to hand out. What I also like to do while we're on here is whenever I sit with somebody, and especially if I'm face to face, I like to put my name and number in their phone as a contact. And then under notes, under that contact where you save it, I put insurance agent. That way, if she runs into Sue or he runs into somebody at the market and they're like, I'm just so confused about this Medicare business, they could say, I have the person for you and pull up the contact on their phone. That way, they're not carrying around your business card or hand it out to somebody or have to go to the refrigerator to look at a magnet. All those are good, but make sure you have your number in their phone. Make calls to beneficiaries who are voluntarily disenrolling for sales purposes or be asked to consent to sales contact. Cannot call beneficiaries who attended a seminar without documented consent to contact. Permitted. This is what we like to know. Marketing reps may initiate contact through email. You must provide an opt-out option that is on the test. You may email. You must provide an opt-out option. Return calls or messages to those who initiate contact. Call those who filled out a BRC, which is a business reply card, or asking a plan customer care rep to have an agent contact them. Call to confirm appointments that have already been scheduled. Call beneficiaries who have submitted enrollment apps to conduct business related to the enrollment. Reps may call current members of a parent organization, including non-Medicare health plan products, to discuss plan business. Agents who already enrolled on the GHP and aging into Medicare, that means if they're already enrolled in this commercial plan and they are aging into Medicare, they can be contacted for Medicare enrollment purposes. Current Medicare Advantage enrollees to promote other Medicare plan types or to discuss options and benefits. Contact MA organizations, Medigap enrollees regarding MA, PDP, or cost plan options. Call current members of a plan to discuss, inform them about general plan information such as AHIP dates, flu shots, plan changes, educational events, and or other important information that is on the test. They can call current members of a plan. It's on module 4 or 5, I can't remember, to discuss, inform them about general plan information such as AEP dates and flu shots. Specific to flu shots is the question. When placing these calls, you must offer the ability to opt out of future calls. Rules for sales and educational events. Marketing sales events are designed to steer potential enrollees towards a plan or to remain in their current plan. Education events are designed to inform potential enrollees about Medicare, MA, Part D, or other Medicare programs without marketing materials or activities. Educational events may be held in public venues and put on by providers or other groups sponsored by one or more health plans. Advertisements and invitations that are used for educational or marketing events must include the following statement. For accommodation of persons with special needs at meetings, call. We all know that one. That is not new. Reps may conduct a marketing event immediately after an educational event, and I did not delete that. That is not true. It must be 12 hours later. I don't know why that's in there. You can right now, but you cannot starting in the near future. Medicare communications and marketing rules, sales events. Plans must submit presentations to CMS that include marketing content before use at an event. At marketing sales events, agents may discuss plan-specific information, including premiums, benefits, star ratings, merits of a plan. You cannot distribute or collect applications this year. Distribute plan-specific and you may provide refreshments and light snacks. Agents may not require beneficiaries to provide contact information, including email, as a condition to RSVP for an event online or through mail. Sign-in sheets must be labeled as optional. Conduct health screenings or other activities that indicate cherry picking. Provide meals or multiple snacks, refreshments bundled and provided as a meal regardless of value. Charlie, did you hear that? Regardless of value. Use information collected for raffles or drawings for other purposes. Agents may engage in communication activities and distribute communication materials. Use a banner with the plan sponsor. Provide an objective presentation to educate beneficiaries on different ways they can get their Medicare benefits. And you may have a healthcare provider make an educational presentation on wellness or other healthcare related topics. Nothing has changed on they may provide gifts, prizes, or promotional items to beneficiaries as part of an event or marketing purpose, regardless of enrollment, without discrimination. When one or more gift is offered on an occasion, combined value may not exceed 15, and you cannot exceed multiple gifts given to a single beneficiary over $75 per year. Gifts or prizes may not be in form of cash or cash equivalents or other monetary reward or rebate, even if less than 15. Cash equivalents include gift certificate or cards that can be converted into cash. General gift cards that are not restricted to specific retail chains or specific items in categories such as Visa gift cards. Gift cards for retailers or online vendors that sell a wide variety of products such as Walmart and Amazon, and debit cards. Those are not allowed. Gift cards that can be used are Starbucks or Shell gift cards. Rebates include a discount on first month's premium or copay are not allowed, and gifts or prizes may not be charitable contributions. Plan sponsors must include a disclaimer on all marketing materials promoting a prize, drawing, communal experiences like a concert, or any promise of a gift that there is no obligation to enroll. That is new for this year. That statement right there.
Sharon, did you have a question?
Yeah, a couple actually.
You can interrupt me anytime, Sharon.
Well, I get calls from clients all the time saying they get these calls, these marketing calls every single day, nonstop, continuously.
Yep.
What are they to do? I mean, I get them too, but they are really inundated with calls. And how are they getting away with that when it's so not allowed by Medicare? That, and also I have been to sales presentations and they have given away $10 gift cards. So how are they getting away with that? They even advertise it. Come to the sales presentation, you get a $10 gift card.
That is very common. If we go back to the gift cards, you are allowed to give the $10 gift cards. Absolutely. But what it can't be is a Visa gift card, and it cannot be Walmart or Amazon. It has to be a specific one. A year ago, we were giving away Walmart gift cards, and a year ago, they said no more. You can't do Walmart or Amazon. So a lot of places are doing gift cards like for Petco, because a lot of beneficiaries have pets. Shell for gas, very specific gift cards.
That cannot be converted. This is the first time I'm seeing where you can actually select Starbucks or Shell gas. I've never seen that.
Yes.
But Here it says no gift cards, even if it's less than $15 in the form of cash or cash equivalent. So is that
Yeah.
new?
No, this came about last year. This specific slide was put in AHIP. It's in this year as well. It is not new. You can give gift cards, but what you can't do is have it in a form of gift card that can be converted to cash, like the Visa gift card.
Okay, but it has to be specific to a certain vendor.
Yeah,
Like-
Yes,
specialty.
you can't have, well, the Visa gift card can be used anywhere. Walmart can be used online, and there's other vendors online on Walmart that you can use. Amazon's the same way. But if you were to give a gas card, then that's very specific, or if a Starbucks card or something like that. There is a question, Taryn, I'm not sure about this, about grocery store gift cards.
Yeah, you can do grocery store, but you can't do Walmart.
You just want to make sure that they are not a department store as well, just specifically groceries.
Yeah.
So grocery, Starbucks, and gas cards are okay, but
Yes, ma'am.
Walmart is not, and Amazon is not.
And neither is Visa, MasterCard, any
Or
of those.
or a
Yeah.
general gift card that can be used for anything.
Yes.
Okay. What about the phone calls that people get and are, I mean, it's pure harassment.
So they have, and you'll see in the future slides, they've actually made some new rules to try to curb some of that, because somewhere, some way, somehow, this is the frustration of our industry, and it's giving us black eyes, because they're calling these people some way, somehow, and they're not getting shut down, and they're changing people's plans without them knowing it until they go to the doctor.
I know. That's why
So
it's not allowed.
I think, yeah, it's not allowed, but somehow they're not getting shut down. And I think that's why they keep developing these rules, like the call recordings and things like that, so that beneficiaries have something to file a complaint with and get caught, right?
Yeah, I have stayed
mess.
on calls. I have stayed on calls and tried to get as much information as possible to try to see who is behind it. And as soon as they get wind of what I'm, or trying to do, or they get an idea that I'm trying to get as much information as possible, they hang up.
Yeah, they do, because they know what they're doing is wrong.
I want to report them. Yeah.
I would. I'd be like, this time, date, this number, and file it, because it's ridiculous. And and people like us who are professionals who want to actually help people and do it compliantly, it's turning people away from us because of the word Medicare and agent.
It's ridiculous.
It is. It's very frustrating. Oh, did everybody get a picture of this? This is a new disclaimer. I'll just repeat it again. Plan sponsors must include a disclaimer on all marketing materials promoting a prize drawing, I can't even say that word, experiences like a concert, or any promise of a gift that there is no obligation to enroll. Okay, marketing at individual appointments. There are some new things here, guys. We're getting into some of the new stuff again. Individual appointments are defined as appointments to an individual or small group, such as a husband and wife. They are not defined by location. During individual appointment, reps may market only healthcare related products identified on the scope of appointment. Products include Medicare health plans, Medigap, and dental, but not accident-only plans. Non-healthcare products cannot be marketed during a Medicare health or drug plan appointment. If beneficiary requests information regarding a different plan type, you will need a complete new scope of appointment. Any questions?
That hasn't changed. That's always been the case, right?
Pretty much. But now this top one is the brand new one. All these were brand new slides on the AHIP test.
Okay.
This is brand new. Stop. This is brand new scope of appointment. At least 48 hours before any marketing appointment, you must coordinate with the beneficiary to identify the types of products that will be discussed, obtain agreement from beneficiary, and document agreement on the scope of appointment. That is new. So there is no more of us just calling people and doing a scope of appointment and meeting with them. It is 48 hours. There is an exception.
Well, that's what it used to be, and then they changed it and said you could do it at this, at the time of appointment. And now it's changed back to the 48-hour rule.
It has.
But that's the way it used to be.
Yep. Types of products include MA, PDP, cost plans, and Medicare, Medicaid plans. A new scope of appointment is required if the beneficiary wishes to discuss a different plan type that previously agreed upon. That is on all the tests. Actually, a couple of times. Scope of appointments are valid for 12 months from date of signature. That is also on the test. Scope of appointments may be in writing, including electronic signatures by the beneficiary or a recorded oral agreement. For appointments made over the phone, documentation is generally in the recording of the call. However, the agent may obtain a written scope of appointment signed by the beneficiary or authorized representative. This must be done before conducting the appointment. And now, as we know, it's 48 hours. There is an exception to that. Plan sponsor may not agree to the scope of appointment on behalf of the beneficiary. I don't even know why it says that. Plans Part D sponsors must submit to CMS all social media and QR code posts that meet the definition of marketing materials, specifically those that include benefits, premiums, cost sharing, or star ratings. This includes posts made by agents. Social media posts are subject to marketing communications content requirements. That is on the test. Reposts are considered a product endorsement testimonial and must adhere to the guidance on testimonials. Okay. Compliance on required practices. I told y'all this is a long one today. Provide prospective enrollees only CMS approved submitted marketing materials for CMS created marketing materials. Use only CMS approved submitted talking points and presentations if they are marketing. Plans Part D sponsors must attain HIPAA compliant authorization from an enrollee to market non-health related items such as accident-only life or annuities. And that is on the test, that you must obtain HIPAA before approaching any of your clients about anything not related, health related. HIPAA authorizations must specify that the individual's information may be used by the Plan Part D sponsor for marketing purposes. Whew. Marketing reps are business associates of health plans they sell. They must comply with federal and state law regarding confidentiality of individual identifiable health information known as PHI. PHI, of course, includes any information about the individual's healthcare coverage, payment for healthcare, or health conditions. HIPAA regulates both the use of disclosure of PHI. Reps may only disclose PHI on behalf of the plans they represent. De-identification is the use of PHI. Agents may not de-identify PHI and use it for their own purposes. If a rep subcontracts with another individual or entity that may obtain, use, or disclose PHI on their behalf, they must enter into business agreement with the individual or entity requiring the same protections to the PHI. The following requirements apply to marketing of plans for 2024 beginning 10/1/2023. Independent agents, brokers, and other third-party marketing organizations must use the TPMO marketing disclaimer unless the TPMO sells all commercially available MA Part D plans in a given service area. So what they're saying is, obviously, not all of us represent every single plan in our area, and we are considered this. So we have to disclose. We do not offer every single plan available in your area. And guys, it's changed from last year. I know it starts out the same. Currently, we represent insert number of organizations which offer insert number of plans, products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your local state health insurance program for help with plan choices. So they switched that up on us this year. The disclaimer must be verbally conveyed within the first minute of the sales call, electronically conveyed when in emailing, online chat, and all other electronic communications, prominently displayed on TPMO website, included in any TPMO marketing materials, including print and television. So where you're going to see this on the test is that disclaimer. Just know that it's changed. You don't have to remember it verbatim, but just be able to pick it out of the ones that are listed. If the lead generating TPMO transfers a beneficiary to an agent, the TPMO must disclose that they are being transferred to a licensed agent who can enroll them into a new plan. Plan sponsors, agent, brokers, FMOs, or agencies that obtain leads from such entities should ensure that these requirements have been met and include this obligation in any contracts with the lead generation TPMO, not on the test. Access and use of certain plan materials. Plans are required to post on their website certain downloadable documents, the EOC, the summary of benefits, the ANOC, provider directory, pharmacy directory, and formulary. Such documents are important tools used by marketing reps to determine beneficiaries' pharmacy is in network, drugs are on formulary, benefits important to the beneficiary, and whether a plan covers out of network. There is going to be a question on there because now you have to, well, we'll get to that. Sorry, I think I'm skipping the next module. Never mind, ignore me. Required materials with an enrollment form. When a beneficiary is provided with enrollment instructions forms, they must also receive a pre-enrollment checklist, plan rating, summary of benefits. Beneficiaries must also receive the multi-language insert when provided an enrollment form or any other CMS required materials, such as the EOC, ANOC, and summary of benefits. For DSNP, if Medicaid benefits are not included in the summary of benefits, a separate document must be provided with the enrollment form. I think that is on the module exam for DSNP. If beneficiary enrolls online, plan sponsor must make these materials available electronically to potential enrollee before the completion and submission. For telephonic enrollments, beneficiary must be told verbally where the summary of benefits and star rating documents may be accessed. There were not really, I say this again, there were not really any questions on star ratings, to be honest with you. Star ratings released by CMS allow beneficiaries to compare MA Part D plans. These ratings include whether members got various screenings, vaccines, and other checkups to help them stay healthy, and how members can rate the plans, such as access to care and customer service. Star rating information documents must be posted on each plan's website. New plans, Part D sponsors, do not have a star ratings information and not required to provide until the next year. Plan sponsors and reps may only mention a plan's rating in conjunction with the plan's overall performance rating, contract's highest rating, Part C summary rating, or Part D summary rating. Plan sponsors and reps may only market the star ratings in the service area in which it is applicable. So what that means is if Devoted has 5 stars in Ohio, but not in Nashville, you wouldn't be able to say this is a 5-star plan unless you're in that area of which they have 5 stars. Plan sponsors and reps may not use plan star ratings in an individual category or measure to imply a higher overall plan rating than is actually the case. Use star ratings in a manner that misleads beneficiaries to enroll in a plan. Use updated star ratings until CMS releases it. Continue to use old star ratings after 21 days of release of new ratings. You really see that if you're if they lose a rating. But again, star ratings really is not on the test. Recording calls. Independent agents and brokers and other third-party marketing organizations must record all calls with beneficiaries in their entirety, including the enrollment process. This includes recording the audio portion of calls occurring via web-based technology. You need to know that for the test. Independent agents and brokers and their third party, their TPMO, must record all calls with beneficiaries in their entirety, including enrollment process. This includes recording the audio portion of all calls occurring via web-based technology. Marketing reps must not market any non-healthcare related products during the MA and PDP sales activity or any other marketing activity for existing clients. This is considered cross-selling. Life insurance and annuities were the examples given in the module. You may not use the beneficiary's PHI for marketing purposes, including sending any non-plan or non-health related information or otherwise contacting them for purposes of unrelated to health plan benefits or CMS contract execution without first obtaining HIPAA required authorization form from the enrollee. That is on the test, that you need to have the HIPAA. You must obtain HIPAA required authorization form if you're going to market anything outside of the plan with them. Market that the plan sponsor will not disenroll beneficiaries due to non-payment. I don't even understand that statement that was on there. If you don't pay your payment, you're not going to have it. MAOEP is when someone who is enrolled in a MA or MAPD plan that can make a one-time change to another MA plan, elect original Medicare, or can change their Part D coverage. That sentence right there is on the test. It's going to ask you what this person can do, and they have original Medicare and they heard about MA plan during OEP. Can they switch plans? The answer is no, but they can change their Part D drug coverage. Those who enroll in the MA plan 1-1 MA OEP is the first 3 months. More information in Module 5. During OEP, reps may not send unsolicited materials advertising the opportunity to make an additional enrollment, change, or reference OEP. Engage in or promote activities that intend to target the OEP as an opportunity to make further sales. Contact former enrollees who selected a new plan during AEP or target beneficiaries who are in OEP because they chose a MA or MAPD plan during AEP by purchasing a mailing list or other means of identification. Any questions? Okay. During OEP, reps may conduct marketing activities focused on other enrollments such as T65, 5-star, D-SNP, and C-SNP. MAOs may also include information about OEP on their website. So I get this question a lot when I'm training reps, especially green ones that are new into the Medicare Advantage space. They ask, well, so what are we supposed to do January through March? We can't market anything. That's just simply not true. You just can't you can't market that it's OEP and that they can make a one-time change. But you can do your normal T65s and your D-SNP and your C-SNP marketing tactics. Marketing in a healthcare setting. Really, all you need to know for this portion of the test is that it needs to be in a common area. That's basically it. But reps must not engage in marketing in areas patients receive healthcare services, such as exam rooms, dialysis treatment areas, hospital patient rooms, pharmacy counters, and any other treatment areas where patients interact with a provider and clinical team and receive treatment. Reps may provide communication materials to be distributed and displayed in the healthcare setting That will also, in the final exam, it's going to talk about somebody in a hospital being uncomfortable with them putting out communications. The answer is in a common area. That's the answer on the final exam. Conduct sales presentations and distribute and accept enrollments in common areas such as cafeteria, community rooms, entryways, waiting rooms, or conference rooms. There is one question about long-term care facility. It is to the effect of that somebody has a family member, they want you to come in and do a presentation, and basically you can talk to these individuals as long as they initiate contact with you and you're happy to schedule an appointment. That is the answer. Long-term care facilities include nursing homes, assisted living, and board and care homes. I'm just not sure still this year what a board and care home is. Plan sponsors and reps may schedule an appointment at the beneficiary authorized individual's request who is in a long-term care facility. And that is the answer, at their request. Reps may set up in common areas and allow residents to approach them. That is not on the test. I promise you the correct answer is that they are happy to schedule something with them if somebody calls them. Plan sponsors and reps cannot visit those in a long-term care facility without an appointment. MA institutional special needs plan may use staff social worker to provide information, including marketing materials for ISNPs to residents. Information must not include an enrollment form. Social workers cannot accept or collect scope of appointments or enrollment forms. Plan sponsors are responsible for ensuring compliance with CMS marketing regulations and guidance, including monitoring and overseeing activities of their third-party marketing organizations, marketing reps, and providers. That is on the test. I'll repeat it. Plan sponsors are responsible for ensuring compliance with CMS's marketing regulations and guidance, including monitoring and overseeing activities of their third-party marketing organizations, marketing reps, and providers. Plans are required to implement strategies to prevent prohibited marketing practices from occurring, detect prohibited marketing tactics in early stages, and take immediate corrective action in response to non-compliant marketing activities, such as disciplinary actions are withholding or withdrawing commissions, retraining, suspension of marketing, and termination. Just know the consequences. And that's on the final, but I don't believe in the module test. Plans must comply with requests from a state insurance or other department in connection with investigation of plan reps who are licensed by the department. Plans must report to the state any terminations of an agent or broker, including the reason. Plans must also report to CMS any for-cause terminations. Report to CMS all enrollments made by unlicensed agent. Upon request of CMS, plan must provide information necessary to conduct oversight of marketing activities. Plan sponsors must require TPMOs, including independent agents and brokers, to disclose the plan sponsor, any subcontracted relationships used for marketing, lead gen, and enrollments. Report to plan sponsors monthly any staff disciplinary actions or violations of any requirements that apply to plan sponsor associated with beneficiary interaction to the plan. Do I have any questions? I need a drink. Okay, moving on. Compensation includes monetary or non-monetary compensation of any kind relating to the sale renewal of a policy, including, not limited to, commission, bonuses, gifts, prizes, or awards. Compensation does not include payment of fees to comply with state appointment laws, training, certification, and testing costs. Reimbursement for mileage, reimbursement for placing ads and purchasing flyers, actual costs associated with beneficiary sales appointments such as venue rent, snacks, and materials. That is not compensation. That is marketing dollars. Should be classified as marketing dollars. So If you get marketing dollars and you get a 1099, that's wrong. It's not on the test. My friendly advice. Compensation for independent agents must comply with CMS guidance. Compensation rules do not generally apply to marketing reps who are plan employees, to captive agents or independent agents marketing to only employer and union groups. Compensation to independent agents who market and enroll beneficiaries are covered by the rules regardless if paid directly by the plan or paid by an agency, FMO, TMO, or similar organization. Sorry, I have the back door open, so we have flies. Compensation may not be paid. Plan sponsors may not pay agents when they have not tested or been trained, when they do not meet state licensing and appointment requirements. When an agent is terminated, any future payment for existing business will be governed by terms of the contract subject to the limits of CMS. However, to continue receiving renewals, agents must remain trained, tested, licensed, and appointed regardless of activity selling. Not on the test, but important to know. Compensation amounts depend on if the enrollment is an initial year or renewal. This is on the test, guys. CMS provides reports to the plan to specify initial enrollment or renewal. Renewal year enrollments include plan changes. Plan type include PDP to PDP, MAPD, or MMP, unlike is MA or MAPD to a PDP or section cost plan, or a cost plan to MAPD. Comp for initial year enrollments cannot exceed fair market value. I think we got a raise this year. Not very much, though. Comp for renewals cannot exceed 50%. Referral fees, the agents cannot exceed 25 for PDP or 100 to all others. Plans must file yearly with CMS if they use independent agents, brokers, and if so, range amounts they intend to pay for commissions. Once deadline for filing purposes, plans cannot change the amounts they pay or types of brokers they use. Okay, this is the part that's on the test. Comp is paid on calendar year basis regardless of enrollment month. Renewals begin January 1st, not the enrollment anniversary. That's literally the main compensation test question there is. Plan sponsors have flexibility to make comp payments annually, quarterly, monthly, or different schedule. Compensation must be paid during the year of the enrollment. Comp can only be paid for the months the beneficiary is in the plan. If the commission is paid in advance, plans have to recoup for the months the beneficiary was not enrolled. Mid-year enrollments are prorated, and plans may choose to pay for an entire year of enrollment for a beneficiary who has never been enrolled in a plan before or moves from group to non-employer plan. So that means new to Medicare. Oh, rapid disenrollment. If a beneficiary disenrolls within the first 3 months, the entire comp amount paid must be recouped. Some exceptions apply. And the exceptions are enrollments with effective dates of 10/1, 11/1, and 12/1 are used AHIP to make a change. That is not a rapid disenrollment. Become dual, qualified for special needs plan, become LIS eligible, lost Medicare entitlement, moved out of a service area, failure to pay premium, moved into a 5-star plan, moved in or out of an institution, death, or plan termination, non-renewed, or CMS sanctioned the plan. Oh boy, that is it, guys. Goodness gracious, sakes alive. I'm sweating. Do I have any questions? Okay. Who's ready for true or false? This is my favorite part, by the way. Okay. I'm just going to read you all the questions. You have been providing a pre-Thanksgiving meal during a sales presentations in November for many years, and your clients look forward to attending this annual event. When marketing Medicare Advantage and Part D plans, what are you permitted to do with respect to meals?
Snacks only.
Mm-hmm.
No dinners.
Very good.
Not allowed.
I didn't know how to rephrase that one to
And
true or false,
definitely
guys.
no alcohol. And definitely no alcohol.
Come on now, man. A
Maybe
wine and cheese party
maybe
to talk about Medicare? Let's do it. Joking. Okay, true or false? During OEP, those enrolled in Medicare Advantage plan have the opportunity to change plans or enroll in Original Medicare. Marketing representatives may respond to beneficiary requests for one-on-one meetings. True or false? OEP. You want me to repeat it?
Yes.
During OEP, those enrolled in a Medicare Advantage plan have the opportunity to change plans or enroll into Original Medicare.
True.
Marketing representatives may respond to a beneficiary's request for a one-on-one
Yes,
appointment.
true.
Very good.
It has to be initiated by the beneficiary.
Charlotte, true. Yes, ma'am. Okay. This one's hard. I mean, it's easy to answer. It's hard for me to rephrase it for y'all. Okay, I'm just going to read the questions. This one. Your client, Alexis Jones, which is also the director of our call center's name, I thought it was funny, calls you on December 4th about changing her Medicare Advantage plan during the annual election period, which ends December 7th. What do you do? There's a 48-hour rule. Does that apply during that time?
No, it doesn't apply.
It does not. You do not have a
Within 4
48.
days.
Yes, ma'am. Correct. Okay. True or false? Evan may provide meals regardless of its value because it's an educational event and not a marketing event. True or false?
I know, but I'll let somebody else answer.
False. This is
Okay.
one that tricked us because never
Yeah.
before has this been discussed. At educational events, marketing representatives may provide meals as long as they comply with the gift promotional item requirements, which limit individual gifts to $15. The value of a provided meal that can be provided to attendees is required to the same limits.
Mhm. Yep.
True or false? Marketing representatives may schedule an appointment with the beneficiary in a long-term care facility only upon their request.
True.
True.
Very true. Okay. True or false? During the first minute of a sales call, Hector must use the disclaimer. It says, I do not represent every plan available in your area. I represent 3 organizations that offer 10 plans in your area. Please contact Medicare.gov or at 1-800-Medicare or your local state health insurance program to get information on all your options.
True.
It sounds better that way than the way I had it typed out. Okay. True or false? A marketing representative may initiate electronic contact through email since it is now considered general audience. marketing similar to print media. Rules regarding unsolicited contact do not apply to marketing through these materials. However, use of electronic media must provide an opt-out process.
Absolutely.
Yep. This wasn't put out there very well, and I'm going to say it because, I mean, I typed it up after this question, but I feel like I just need to teach y'all this. Okay. Now we have to, prior to enrollment, Linda must provide Maria with information about whether or not her primary care provider is in the plan's network, whether or not her prescriptions are covered by the plan, and monthly premiums and costs. That is now required at every enrollment.
True.
Yep. Hey, John Oakley. I didn't know you're on here.
Slipped in the back door.
Ah. True or false? Marketing reps may not engage in marketing activities in common areas of a healthcare setting.
False.
False.
Very good. You can. I was trying to trick y'all.
Not very nice of you.
Takes more than that.
We'll get you back.
Okay. True or false? Maybe I'll get y'all on this one. There is no testing requirement for agents and brokers that market Medicare plans.
False.
False.
Y'all are just too smart for me.
Actually, too much testing.
I know. We're doing AHIP, and then we're going to do our certs, and there's going to be AHIP questions all through that. It's our favorite time of year, guys. Come on.
It's not so bad if you don't have your, your license CEUs due at the same time.
My CE is due in December.
Yeah. You have to go through that. Yeah, I'm not due till next year, so it's not as bad as it was last year.
So we're alternating bad years. That's what you're telling me.
Yeah.
Okay. A plan sponsor must obtain a HIPAA authorization from an enrollee before using or disclosing enrollee's information to market non-health related items such as life insurance.
True.
Very good. Oh, this question was so long. We're not doing that one. That one was it was 3 paragraphs. It felt like. Not really.
Is
It was
on
so
the
long.
test?
Yeah. Do you want me to go over it? Okay, fine. I'll go over it.
Yeah, if it's on the test. We'll be patient.
Now, our questions could be different than the ones that our test could be different, right?
Your
And the
final
one-
test, yes. But
It's
the
not gonna be
module
the
tests are
same.
pretty standard. Yeah.
Yeah.
Although everybody I've talked to has had the same questions I have.
Yeah, there's ones that they ask every year.
Yeah. For the most part, the ones that were kind of confusing, we all had the same question. All that's about that one. Sorry, I thought it was a different one. All that one is when you get paid commissions and if it's prorated. I'm sorry, I thought it was the one that had like 5 different people in there in a scenario for each one. I think that's
Yeah,
that's tomorrow's.
Yeah, I hate
So
that
that's
one.
true. Prorated commissions was true.
They are prorated and then they renew regardless of the time of year that they enroll. The renewals are in January.
I feel like we don't make the same amount of money when they do that.
Not, yes, they have to put their marketing. Some of these we already know. Okay, this is a good one. This is a good one. Let me read you the question. Agent Daniel Weber has properly set up a sales appointment to meet with client Edward Young at Agent Weber's office. At the agreed upon appointment time, Mr. Young arrives with his elderly neighbor, Clara Burton, who wants to learn about her Medicare Advantage options. What should Agent Daniel Weber do? Can he meet with her? Yes or no?
Get a scope of appointment.
Yes, because the new 48-hour rule, if somebody unexpectedly approaches you and wants to, you can go ahead and do a scope on the spot. Charlie, Paul Gauthier's that keeps trying to call me.
I'll get him. Thanks.
Thank you. Okay. Marketing, true or false? Marketing events are prohibited from taking place within 12 hours of an educational event at the same location. Scheduling the meetings 1 hour apart in the same hotel violates this rule.
False.
True,
It's true now, John.
true,
12
It
hours?
is true.
true.
12 hours. We can know,
12 hours.
yeah, 12 hours is the new
That's
rule.
the new rule, 12 hours?
Yep, no more educational and pivoting with a bathroom break to a marketing meeting.
Huh.
12 hours.
So if you do a meeting at 10 o'clock a.m., you can meet with them again at 10 o'clock p.m.
Mm-hmm. Yeah. And we can no longer schedule
10:01.
appointments with them at that educational event.
10:01.
Okay, I understand the point of an educational event. I get it. I'm a director of this provider program. Like, I get the compliance. But do we not all enjoy, when we're in sales, to do an educational event and flip over to a marketing event or collect or schedule or do something and not just educate for educating? Because once they leave, what are the chances of us getting them back? I open this up for discussion.
Well, you can still get a contact, right? Slip.
BRC,
Yeah, that's what you're supposed to do, right?
is
Permission
that
to
what?
contact.
I-
Permission to contact. That can be done at a marketing. Can it
I'm
not?
going to have to look that up. I'm going to have to look that up because I don't think we can do that anymore.
You can't do the SOA.
Oh, but
But
you
I
can do the
think-
BRC. You're right.
Yeah, you can do a permission to contact. That's what you have to do. And I highly advise it, or you will lose them.
So you can't see them within an hour after?
Nope.
You still have to wait 12 hours,
Yeah,
even if you get a permission to contact.
I don't think that's the case. I think what they're talking about, and this is my understanding, and it's open to interpretation free. So let's all discuss this so that we get it right. My understanding is, so when I was out in the field, I was at a doctor's office. I would do an educational event, serve coffee, donuts, and then I would say, that's it for the educational event. If you'd like to stay and learn more about certain plans and, benefits and blah, 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 please stay. You go refresh your coffee, go to the bathroom, come back, and we'll dive right in. And went into a sales presentation, a marketing event. So now what they're saying is, and they're trying to prevent that from happening. And I think they're saying that you cannot have a marketing event an hour later. It has to be 12 hours later. Is anybody, what do you all think?
Yeah, I think that's true. I think they want the prospect, the senior, to go home and think about it and not be kind of rushed into making a decision and an enrollment, to happen right away.
But it says at the same location. So what if I did
at
my
the same location.
presentation at Golden Corral
Mhm.
and lunch is over and somebody's like, I really want to sign up today. I'm ready. I want that plan. And I'm like, okay, well, let's make an appointment and come to my office. Does that have to be 12 hours later or can that be in an hour?
Yeah, I think it has to be
12 hours.
I do. I think it's a 12-hour rule. Although who's going to say, how are they going to know? I don't know. I guess.
Well, you can't require sign-in sheet, so there's no way to track that. I mean, honestly, this is what I do. I think about CMS. I'm like, there are so many holes in this.
Yeah.
Let everyone know oh, that's my recording thing. I thought somebody popped up a question. It says, let everybody know they're being recorded.
Yeah.
And the 48 hours is for Charlotte is for the scope of appointment. They sign a scope. Yeah, that plays into that too, because if somebody wants to sign up after the educational event, you're still going to have to get an SOA signed. You're going to have to wait 48 hours.
So that's more than 12 hours. Now it's 2 days. Now it's 2 days later.
That makes sense. Yep. You just solved the mysteries of Medicare.
Yeah.
All right, guys.
So
any other questions?
Okay. So you can't contact them for 12 hours and you cannot enroll them for 48. Is that it?
I think so.
Well,
think
unless
so,
you
too.
got scope of appointment before your educational meeting.
48 hours before. That's true, John.
Yeah.
Okay, Charlotte, I will. I have to tell y'all, Module 5 was so easy. Tomorrow's is easy. I took the final exam. Oh, I was going to go back to the beginning for the new stuff. Hang on. Let me share my screen again because we had people join us late. Sorry. Let me go back to the beginning. Charlie had to jump off to talk to our boss because he kept calling me. Here you go, guys. Who's my boss?
Yeah.
Paul Gauthier.
Okay. Haven't heard of him.
He is the founder of Medicare Compare USA.
How about that?
Yeah, and then Carrie Linderman is our CEO. Sometimes I work for her too.
She's out Washington.
I love her. So for those who join later, I put this as the first slide. Scope of appointments must be obtained 48 hours before all marketing appointments. The two exceptions are unexpected in-person meeting initiated by the beneficiary, and if the meeting occurs within the last 4 days of the relevant election period. Requests to be contacted are good for 12 months. Examples are scope of appointment and BRCs. Marketing events can no longer be held following an educational event. Scopes may no longer be collected, nor scheduling future appointments during an educational event. So like you said, consent to contacts. Call recordings are only required for sales, marketing, and enrollment calls. TPMO disclaimer, we went over that numerous times with the amount of plans you offer, how many are available, and get them over to SHIP. CMS has specified a list of topics that must be addressed with the beneficiary before enrollment, such as premium, formulary, cost shares, etc.
Okay. Do you need our email address to send us?
Yes,
these?
that helps so much.
Yeah.
Yeah.
You want it in here? Do you want me to give it to you now or do you want me to email it?
You can put it in the chat.
Okay.
Unless you don't want somebody else to see it. In that case, I don't know how to secretly send it to me unless I give you my email. And I will put my email on here for everybody. All right, guys, any questions for me?
No, thank you. I'm
You're
gonna go get
welcome.
something to eat. I'm starving. And you know what? It worked with the treats. They were so quiet. I didn't even know you had dogs today. It worked.
Okay,
Do the
this
same,
bag,
do the same tomorrow.
look,
Do the same tomorrow.
I kept handing them out and they went through the whole bag.
Uh-huh. They're
Well,
full of treats. Yep.
I
Oh,
need a
boy.
Petco gift card.
let's go.
Yes. Okay, thank you.
You're welcome.
Thank you.
You're welcome, John.
Okay, see you, dear. Bye-bye.
right. Bye. Bye, everybody.
I may not make tomorrow. I may be playing golf, so,
Well, go play golf. I'll get it to you. You know that.
okay. All right.
All right.
Have a good
Bye.
day.
You too. Bye.